Hi, honey. How are you? I'm so glad that you're back. I missed you so much. Mm-hmm. I do have a question for you, though, before we get down to all the fun stuff. Can you handle it? You're so good for me. All right. What is the most effective method of birth control? Oh, abstinence. My sweetie pie. You know that's not the right answer. Many studies have shown that abstinence only education, funded by the US government throughout the 80s and 90s, actually led to an increase in teen pregnancies and STIs. And the US continues to rank first in both of those categories among developed nations. It's much more responsible to be knowledgeable than to stir fear around a perfectly natural activity for human beings. And you agree, it's natural, right, baby? So, back to the original question. It looks like I will have to do some teaching today. All right, listen up and be good. You will be rewarded. When deciding on a birth control, it's important to discuss with your doctor about your goals with contraception, any potential side effects, and how they might interact with your own medical conditions and history. You should feel safe to vocalize your concerns and expectations about contraceptive options. Many people don't take the time to understand the mechanisms of action, the hormonal content, the reversibility, or the risks and potential complications of what they're given. But you're smarter than that, aren't you? You want to know all of this information so that you can be the best partner for a lady like me, right? Good boy. You are being such a good boy. Now, keep listening for me, okay? Yeah, just like that. Let's start at the bottom. No pun intended. The rhythm method involves only having unprotected sex during the least fertile window of the menstrual cycle. This requires careful timing and planning, but ultimately is only 77% effective at preventing a pregnancy when used by itself. The rate can go up when combined with other birth control, but it is quite unreliable as a whole. Now, single-use methods are primarily aimed at preventing sperm from reaching the reproductive system. These need to be applied every time you have sex and include the cervical cap, which is only 78% effective, and using a spermicide, which is only 79% effective. The internal condom worn inside the vagina is also only 79% effective versus the external condom worn on the penis, which is 87% effective. Condoms are very important because they're the most effective non-hormonal method and are also the only ones that provide a barrier against transmitting STIs. And no, you cannot combine these. All of that friction would break them apart. There's only one thing that I want you to break apart. Anyway, hormonal methods are more reliable, but also involve complex interactions with the female hormone system. These require prescription by a doctor. Combined estrogen, progestin, contraceptives are 93% effective at preventing pregnancies when used by themselves, and they can come in the form of a daily pill, a weekly patch, or a monthly vaginal ring. By constantly introducing hormones into the body, these methods inhibit the mid cycle LH hormone surge, which prevents ovulation from occurring entirely. By modulating ovulation, this also provides a protective benefit against ovarian and endometrial cancer. It is also very helpful in treating acne and hirsutism caused by conditions such as PCOS and in treating pain caused by endometriosis. However, this is not without side effects, which include increased risk of breast cancer, blood clots, weight gain, gallstones, and depression. They are contraindicated in patients over 35 years old or with any history of blood clots, including stroke, or who actively smoke. How are you doing, baby? Is this okay so far? Yeah, are you being good for me? Are you paying attention? Good boy. You make me so proud when you listen to me, baby. Mm-hmm. Now, keep paying attention. This will be on the test. The most reliable methods of birth control are the long-term hormonal methods. The progestin injection, better known as Depo-Provera, is administered once every 12 months with a 96% effectiveness. This works by causing endometrial decidulization and eventual atrophy, which makes the uterus a less viable place for a fertilized egg to properly implant and gestate. The thickening of the cervical mucus also makes it harder for sperm to reach the egg in the first place. This is a good option for women who have medical contraindications to the estrogen-containing methods. The benefits are that it can be resumed immediately after giving birth, and it provides protection against endometrial cancer. However, it does have risks of menstrual irregularity, irregular bleeding, abdominal pain, weight gain, and early reduction in bone density. You got that? Yes, you do. You're so good, aren't you? Okay, now, number 2. We have the intrauterine device, also known as an IUD. It is a T-shaped device, roughly the size of a paperclip, that is inserted by a doctor into the uterus with strings that exit in the vagina to allow for removal. There are 2 types, and they both create a sterile inflammatory reaction that is toxic to both the sperm and the egg. The copper IUD is 99.2% effective and can remain in place for up to 10 years, but it does come with an increased risk of heavier bleeding during menstruation. The hormonal IUD releases levonorgestrel and is 99.8% effective, but is contraindicated in patients with active breast cancer. Both IUD types are contraindicated in patients with abnormal uterine anatomy, such as in bicornate uterus or cervical stenosis. Okay, big boy, we're down to number 1, and you have been doing so incredibly well for me. Now pay extra close attention, okay? At number 1 is the contraceptive implant, also known as Nexplanon, which has a 99.9% effectiveness. It has a similar hormonal makeup to the progestin injection, but is a small 2-inch plastic rod inserted right under the skin of the arm. This needs to be done in a doctor's office, carries a risk of bruising and infection, as well as the risks like the injection. What about pulling out? Well, that's known as the withdrawal method and is only 80% effective when used by itself. And besides, you're not gonna pull out, are you?